Hello, I'm Alison Sutton, developer of the GIZ-methodology, and I'm really excited to be able to share with you in this webinar in-depth information about the methodology and about the way that it's currently being used in the Netherlands to transform the way that professionals in education, welfare and care, together with families, are making decisions designed to meet children's developmental needs. By the end of the webinar, I hope you'll have a really clear idea about why so many professionals and the families they work with are getting really excited about the difference that the GIZ is making to the quality both of the dialogue that they have together and the relationships that they have with each other, but also ultimately to the quality of the decisions that they make to ensure that the children in their care really thrive.
Let's set the scene. What is the state of affairs in the world of care and education? Across the world in the field of family and social work, there is long-standing awareness of the need to work collaboratively with parents. Since the early 90s, emphasis within policies have been on working in partnership with parents. However, the reality is that practitioners are haunted by high-profile stories in the media of societal failures. In practice, there is a lack of transparency and behaviours are influenced by a risk reflex, the reluctance to base decisions on trust. In education, teachers live in the limelight, facing strong emotions from parents fueled by media attention, on top of all other political changes that they cope with at a classroom level. What is really refreshing is the growing awareness that professionals and parents need room to make use of their own expertise, and a growing awareness that the latest brain research provides important insights into how the needs of all parties can be met. We need methodologies that provide focus. What do we all want? To meet our children's needs so we can unite behind a common goal.
There is an exciting new methodology developed in the Netherlands called the GIZ-methodology. This methodology is groundbreaking. It's been recognised for its new ability to create a foundation of trust between professionals and families. It's a move away from rigid protocols towards flexible, tailored care. In using the methodology, the professional creates a positive atmosphere from the outset. This engenders trust, and in turn, one of the first things that's noticed is a lower resistance on the part of parents, children, and other family members to get involved in the discussion. Authentic and meaningful dialogue draws parents and children in and leads towards more cooperation. This better cooperation, also between professionals of different disciplines, may mean that some consultations are shorter. Certainly the flexibility in which these consultations are run can lead to consensus-building conversations and therefore collaborative decisions. Overall, both professionals and families grow in their own sense of strength and become self-determining. Relationships evolve that delivered tailored care. Ultimately, there can be cost savings in this new way of working. This isn't going to happen overnight. We've observed with the organisations that we work with that because the GIZ methodology causes such a fundamental change, implementation is a process. Just because something seems like a good idea doesn't mean that we won't meet resistances along the way. People need time to get used to new ways of working. It is in fact a paradigm shift to work in a way that is based on trust. What's new creates challenge. But as the old saying goes, no pain, no gain. Have you heard the story of what lobsters need to do? Lobsters are not born with an ever-expanding shell. Their hard shell must be recast as their soft body grows inside. How do they know to shed one shell and develop another? They need to experience pain. At a certain point, the pain messages inform the lobster to take themselves to a place of safety and shed their old skin to develop another. Pain provides a purpose. No one likes change. Human beings are creatures of habit, but we need to change to grow and develop. In this way, we learn how to trust in ourselves, how to solve our own problems, and ultimately how to experience ourselves thriving. If change is a painful process, we need something to guide us through. Any specialist in change management will tell you that it's essential to create a vision of where you want to be. You could think of a sailing boat and those on board keeping an eye to the horizon, trusting that there will be calmer waters ahead, even when in the midst of a storm. Imagine that whatever the weather, whatever the obstacles, whatever the state of the ship, you could lead every family and every child along their journey, helping them stay on course, continuing safely towards their chosen destination. After all, we all want to see healthy, functioning children. Can you imagine being able to effectively help every child and family to handle their own challenges, to support them in avoiding pitfalls and navigating changing needs of different family members, and to determine when to bring in a colleague with complementary expertise, because you can communicate in a language that they will understand the holistic story for that child's unique circumstance and needs. With the GIZ-methodiek in your hands, you have what it takes to be an effective support for families in your care, supporting families whilst recognising that they undertake their own journey. To appreciate the GIZ methodology, it's necessary to take a step back and understand where it all began. More than 20 years ago, in England, when Alison was working as a teacher, at the start of the year, she was told that more than one child in her class was facing extreme family difficulties. One of these was a boy called Danny. During the summer holidays, his family home had experienced a real disaster when the water tank broke and made the whole house unlivable. Danny was one of 10 siblings. The family was now split across several households. For an entire term, it was really difficult for him to attend school, as his parents juggled this scenario. As Danny's teacher, Alison became involved with multiple professionals, social workers, medical professionals, psychologists, and truancy officers, all working independently from each other. Numerous meetings with other school colleagues as well were held in order to try and understand how to best organise support for Danny and Danny's siblings and the parents. However, there was frequently miscommunication and lots of misunderstandings. Danny's mother had confided in Alison that she felt everyone was running around busying themselves with her family, and she herself didn't have a clue what was going on. And hence the first version of the GIZ methodology was born. It was an A3 sheet of paper that Alison had pinned to her desk at home. It gave focus and an ability to have a grip of what was going on, who should be included, and crucially what the family themselves were doing to take control of the situation. The whole process gave Alison a clear understanding. The lessons learnt were: families need to be listened to, they need to have their own expertise and emotions acknowledged, and they really need to be involved in decision making. Later on, in 1997, Alison emigrated to the Netherlands and became involved in the field of behavioural sciences. As a researcher and then as a policymaker, practitioner and independent advisor, she further developed the methodology. It became known, instead of the Danny methodology, the At-Risk Children, or ARCH, checklist and care plan. From there, Alison went on to work for CJG Rijnmond in Rotterdam, the largest cluster of family centres in the Netherlands. And the ARCH research was augmented by insights from her own work experience and further research findings, and these provided the basis for the so-called Ernst taxatie method. Alison's independent work under her own practice, Child Rearing Matters, has meant the methodology has had further improvement through incorporating the latest brain research, literature on play therapy, and a new colourful scheme which has improved the transparency and focus of the decision-making process. In 2012, working as an independent advisor for the GIZ Hollands Midden, regional state providers of healthcare in the Netherlands, Alison worked with project manager and researcher Marianne Bontje to further develop the methodology. This was prompted by the announcement of the reform of the public sector and a need to bring the walls down between all specialised services. The regional academic workplace, whose function it is to translate government policy into theoretically robust practical tools, conducted a pilot study of the GIZ methodology, the results of which clearly stated this new methodology to be useful, understandable and meaningful. The GIZ methodology went on to receive acclaim in 2014 from the jury of the National Youth Care Awards in the Netherlands, and it is now recommended in the published in 2016 National Guideline on Effective Decision Making in Youth Care. In the last 2 years, thousands of people have now become trained in the use of this methodology. Nurses, psychologists, doctors, teachers, social workers, health visitors, and we're even beginning to train midwives so that they can prepare parents even before the birth of their first child. Because this methodology can be used to keep an eye on how their child is developing in all areas, and even children themselves find it a fun tool to self-monitor. There is already international interest from the UK, Switzerland and New Zealand, to name a few places where it looks like this methodology may soon be adopted. Let's look at why the GIZ-methodiek can make not just differences at a practitioner level, but has the potential to change culture. Virtuous circles are created when people start to operate from a basis of trust. Trust in themselves, trust in each other, and trust that families and state can cooperate for the benefit of all. What does a nation need? Genuine risk management, without people acting conservatively or operating from what's often referred to as a risk reflex. This may lead to greater prevention, decisions based around prevention as opposed to curative care, empowered self-determining professionals and families cooperating together. And of course, a nation needs effective use of limited resources. All 4 of these elements reinforce one another. And let's now look at what organisations need. Justifiable and cost-effective interventions. Cooperation and collaboration across all interfaces, both within the organisation and in their liaison with others. Accurate, holistic and flexible assessments. And ultimately, transparent, targeted decision-making. Again, all 4 of these elements reinforce one another. On a day-to-day level, what is it that professionals need? Professionals need to work in trust with families. They need joint decision-making, where families buy in and understand propositions. They need to use their own expertise, and they need active engagement with families. And the last of the 4 levels that we're looking at, what do families need? Families want to feel heard, respected, and helped in appropriate ways. They want to be validated for their own competencies. In other words, to realise that they are doing at least some things well, even in times of trouble. They want to receive the tailored support that they are looking for. And they want to feel empowered, to be able to see the bigger picture and to trust in their own abilities. So we can see, at all 4 levels of society that we've looked at here, there are benefits that arise from the open and structured dialogue that is fostered from use of the GIZ methodology. We're now going to look in more detail at what exactly is this methodology. If you could summarize the GIZ methodology, you might say this. There are three key elements. It is a framework for effective decision making. It's a holistic and flexible assessment of needs. And it has as its design a beautifully visual game board that is key in leading to cooperation and empowerment with those who use it. Let's now drill down and understand this methodology in even more detail. There are 5 core elements that underpin the scientific and theoretical understanding that is required to really use it properly. The methodology provides the user appropriate knowledge, a clear shared vision is established. There is a transparent framework to be used as a basis for decisions. At all times, a positive attitude is essential. And finally, optimal communication methods are used. Taking each of these in turn, first of all, what does it mean for a user to have appropriate knowledge? A professional, when using the GIZ methodology, is able to also use a crib sheet that explains to them what they should be expecting to see for what is normal and healthy in a child of a certain age range. For each age range, there are 10 areas in which they look for signs of normal and healthy development in a child of that age. How does a professional create a clear and shared vision? Well, this comes from the use of the game board. The professional is able to ask parent or child, or both, what is going well? What are you coming up against? A picture is created of the circumstances, the way that that family experiences them in that moment. The game board creates a vision. The dynamics are clear to see. In which direction does that child need to be heading in next? The game board gives a positive focus, all interactions are playful and colourful, and it's designed to appeal to emotions. I think you can begin to appreciate how this clear vision can lead to targeted interventions. What sits behind the assessment of needs that gives it rigour? At every assessment, the holistic picture of the child is looked at. At 3 levels, what we've called the pyramid of strength considers all 3 areas of influence in a child's life. The child themselves, their upbringing, and their environment. These 3 main areas expand to 10 mutually exclusive and collectively exhaustive, in other words, a complete list of more detailed areas to explore between the professional and family together at every assessment. The 4th area that underpins the methodology is the use of a positive attitude. There's a whole lot behind this. Firstly, this draws upon the field of science of positive psychology. Secondly, the field of motivational communication skills. And thirdly, solution-focused working. Put all these 3 aspects together, and there is a safe basis on which the conversation can flow. Families are made aware of their own strengths. Awareness of these strengths is reinforced through the discussion. And then these strengths are used as a basis for discussion of other areas, which may include areas of weakness. The 5th core element that completes the theoretical underpinning of the GIZ methodology is the use of optimal communication. There are 9 specific motivational and solution-focused communication techniques that must be used by the professional flexibly. The training offered by the GIZ Methodology Foundation makes it clear how professionals can dip in and out of these techniques. These techniques include reflective listening, the ability to ask open questions, and the ability to ask permission through the questioning process. When all of this is put together, how do we know that this methodology works and adds value? Well, the extensive pilot study conducted in Leiden in the Netherlands showed, and I quote, Finally, there are now room and tools to promote an authentic needs assessment conversation. And listening to what young people themselves have had to say, we've heard some wonderful anecdotes. "It was a super cool discussion," said one young person. "Now I get it, everybody needs support." And "I really like the scheme, it gives a good overview. Can I take one home?" And another great quote, "Last time I didn't feel good. This time I see from the green areas that there are things actually going well for me." Now I'd like to share with you some direct footage from professionals themselves. This footage is taken from professionals in the Netherlands who are currently working with the GIZ methodology, and there are subtitles.
Nou, mijn naam is Marieke Prinsen. Ik werk als jeugdarts bij JGZ Kennemerland. De GIZ-methodiek maakt het voor ouders makkelijker te begrijpen waarom wij over heel veel verschillende aspecten van hun leven vragen stellen. De visuele ondersteuning laat heel duidelijk zien wat er allemaal belangrijk is voor de ontwikkeling van hun kind. Zodat de vragen die wij stellen veel duidelijker in een kader geplaatst worden.
Mijn naam is Saskia Kreuger. Ik werk als verpleegkundige JGZ bij Jeugdgezondheidszorg Kennemerland. Het werken met de GIZ-methodiek levert mij een heel compleet en open gesprek op met de ouder of de ouders. En door middel van een hele fijne methode breng je samen met de ouders in kaart waar hun krachten liggen en hun leerpunten.
And let's hear from what a parent has had to say about the GIZ methodology. This is Simone Keizers, another example of a parent needing to engage with multiple professionals. Simone was able to actively choose to engage with the GIZ methodology in its fully developed form, this time everyone benefiting by taking an integrated approach to solving difficulties between parties. Here are some quotes from what she said after the use of the methodology. "I felt the whole story was listened to. We felt heard and understood. All aspects were considered. Previously, I felt like a failing parent. In using the GIZ methodology, we felt we were part of the solution." I've spoken about the cultural change that is in the potential of the GIZ-methodiek to make. We at the Foundation for the GIZ methodology really believe that it's possible, once there's a critical number of people using the GIZ methodology, that there will be a fundamental shift in the way that risks are managed at a societal level. We want to become more self-determining, not just individuals and families, but professionals in their work as well. And we believe the methodology creates the conditions in which everyone can be self-determining, in which everyone can thrive, and in which society as a whole can live using their competencies, feeling autonomous, and in connection with one another. Practical reality then. How do we make this happen? Well, already, here at the Foundation, we're working with several organisations and many independent professionals in the sectors of care, welfare and education. We also work directly with parents by giving workshops and trainings in the community. As part of a gradual implementation process, we offer a variety of training modules and also advice sessions. We identify a coordinator, someone responsible within the organisation who can help make sure that there are steps taken to begin to shift culture, to begin to change working practices, and who will take responsibility for the change process. The training modules include basic training in the methodology so that professionals can get started using it as soon as possible. There's a separate module for those people who might want to train as coaches. That is, they take a responsibility to ensure that the GIZ is used properly in practice and coach their peers in this. There is also an annual consolidation training, and there's a well thought through licensing process that ensures that people are bought into the community of use and will commit to supporting their peers in the use of the methodology as intended. You can now see why it's vitally important that the implementation process considers the GIZ methodology to be way more than just a tool in the box. Professionals, when they practice with the GIZ methodology, can see right from the outset the difference that it can make. And this is important too, that at every level of the organisation it's appreciated in this respect. So we at the Foundation, we've created visuals that help the implementation coordinator to see the value of their role, to see how they need to influence both upwards and at every other level of the organisation. We support users in the development of case studies, for example, as a way of illustrating the value of the methodology in practice. Let me now hand you back to Alison.
We hope you've enjoyed this webinar. We've certainly enjoyed sharing with you the difference that the GIZ methodology can make to families, professionals, organisations, and ultimately, we hope, to society itself, as we all strive to meet children's developmental needs. If you do decide to implement the methodology, we've seen that it leads to greater trust between professionals and families, and to decision making that really does build on the strengths and expertise of all parties involved, so that everybody can stand behind the decisions that are made. That's tailored care. You've heard in this webinar about the phased development of the GIZ methodology. You've also heard about the scientific underpinnings of its careful implementation in practice. You've heard success stories from families and professionals. And you've seen in this way that the GIZ methodology is more than just a tool in the professional's box. It's a way of working, a mindset that enable professionals and families to work together in ways that are empowering to both parties, in ways that give them the feeling, I'm self-sufficient, I'm self-directed, I have strengths that I can use with the families that are in my care. The Stichting GIZ-methodiek is a non-profit organisation which we set up to promote good decision making to meet children's developmental needs and the needs of other vulnerable groups. We offer the highest quality training and advice modules to professionals at all levels, both within and outside organisations, so people with their own practices. In those trainings, professionals learn how to implement and use the GIZ methodology in the way it was intended. Always taking into account your needs and your budget, the Stichting GIZ-methodiek can help you to work more effectively with families. If you're interested, please first take a look at our website, where you'll find lots of free documentation that you can download. See if you too would like to be part of this movement that we're trying to catalyse with the GIZ methodology, a movement towards a more self-directed, trusting, self-assured society. If you'd like more information, then you're always assured of a friendly welcome if you ring our core team in Utrecht. Thank you very much for listening.